We're going to move on to our next presenter, who is Dr. Diana Callender, who will give us a presentation on Could It Be Cancer? Know Your Risks. Dr. Callender is the clinical hematologist, graduated from the University of the West Indies at Mona, and completed her Clinical Hematology Fellowship at National Institute at Bethesda, Maryland, and has worked as a consultant at Queen Elizabeth Hospital in Barbados, and also served on the faculty at Medical Sciences at UWI. In 2013, Dr. Callender returned to Geisinger Medical Center, where she has served as in many leadership positions until her retirement in 2020. One of her interests has been continuing to talk about health disparities in women. So I give you Dr. Diana Callender. You're on mute, unmute. Thank you.
Okay, all right, thank you very much. I would like to start by saying that there is going to be a lot of overlap in our presentations, and you will see that there's a lot of overlap between my presentation and the previous presentation in terms of risk factors and so on. I'm now going to share my screen, which is that. And what we're going to talk about a little bit is, could it be cancer? And in terms of talking about women's health and cancers in women, there's just so much to cover. And I'm just going to give you a very brief overview of the risk factors, the signs and the symptoms, and touch on cancer of the breast, ovary, the uterus, including the cervix and endometrium. This is not comprehensive, and many of the signs and symptoms may be associated with other diseases, and some of these will be addressed later. So I think it was really important that we had that previous presentation about Know Your Body, because if there's anything that is changing, I think one of the main messages to take away from today is always check with your doctor. Don't assume it's nothing, don't assume it's cancer, but always have any changes checked out. All right.
Before you start, Dr. Callender, you're not sharing your screen.
Oh, okay. Sorry. Let me try again. I think I did the same. Made the same mistake that I made earlier. Thank you. Okay. So I'd like to talk a little bit about breast cancer. Breast cancer is the commonest cancer in women. And we each have about a 13% chance of developing breast cancer in our lifetime. And about over 250,000 women get breast cancer every year. And you can have a significant number of deaths from it, but we have made tremendous advances in the diagnosis and management of it, which is addressing this. Unfortunately, some of these, we have more women who are Black having more aggressive cancers being diagnosed and being diagnosed later than white women. A lot of this has to do with access to care. And there are also some biological factors that seem to make it more aggressive in Black women that these are being studied now. This is going to be very high level. And so in terms of thinking about your risk of developing breast cancer, some of the risk factors include alcohol consumption. So, and the risk increases with the amount of alcohol that you consume. So for women who have like one glass of wine or one drink a day, that may increase your risk of getting breast cancer about 7 to 10%, or above women who don't drink. Those who have 2 drinks a day or more, that would be, the risk would be increased about 20% above those that don't drink. So this is something, as you think about your lifestyle choices, for you to consider. Physical activity is a really important issue that we will probably revisit several times during the course of the symposium. Regular physical activity, research has shown, reduces breast cancer risk, especially in postmenopausal women. And again, we're still trying to dig down into this and find out exactly why, but some of the thoughts are it could be due to effects on the body weight, due to effects on inflammation, and also due to effects on hormone levels. And lack of physical activity is often associated with overweight, which is associated with an increased incidence of breast cancer. So overweight and obesity, especially after menopause, and a lot of the cancers in women have to do with hormonal imbalances. And after menopause, most of the estrogen that women produce, we just heard about going through menopause and the difference in the hormones of estrogen and progesterone that are produced. Most of our estrogen then comes from fat. And if we are carrying a lot of weight and have a lot of fat, we are producing more estrogen, which is acting on the breast. Overweight women also tend to have higher blood insulin levels, and this has been linked to breast cancer. So far, alcohol intake, physical inactivity, and overweight are factors we've talked about so far. Some of the other things that have to do with how it affects your hormonal balance through the years, and that balance of estrogen and progesterone and so on. Not having children, women who have not had children or had their first child after age 30 have a slightly increased risk of breast cancer compared to those who had children younger. Having multiple pregnancies and becoming pregnant at a young age, again, because of the changes in hormones of the slot, reduces the risk of breast cancer. Not breastfeeding, or put it another way, breastfeeding may lower the risk of breast cancer slightly. Now, this is something I find interesting. It says, especially if it continues for a year or more. And I'm not sure how many women in today's world are able to breastfeed for a year. I know my daughter is trying mightily, and she is breastfeeding still at 8 months, but it's a tremendous struggle. So this is something that many women are not able to do, especially if they're working. Menopausal hormone therapy. Using combination of hormone therapy, which is a combination of the two hormones that you heard mentioned just now, estrogen and progesterone, after menopause, increases the risk of breast cancer, starting about 4 years after its use. The cancer may also be found at a more advanced age. If you stop it after about 5 years, the risk decreases, but it doesn't seem to decrease completely. So this is if you're using hormone therapy that has in both estrogen and progesterone. Using estrogen therapy alone has mixed results or no effect on increased risk. So a conversation, again, I think, again, one of the things you're going to hear repeatedly are conversations with your healthcare provider, and a real serious consideration about if you do want to have hormone replacement therapy, because this can have adverse effects. And this is not the only one. So going back to knowing your body, how do you know if you have breast cancer? So you might have a lump in your breast. So if you do know your breasts, and if you look at them in the mirror, or if you feel them and you do a regular breast examination, if you feel a lump, that's something you should think about. Now, some women have naturally lumpy breasts. And so it's really important for you to know what your breasts feel and look like. If there is swelling, redness, or increased warmth of the breast, if it changes in size and shape, so our breasts change in shape over time as we get older. But if you find that one breast especially is looking different from the other, that's something that you should have checked out. Itchiness or scaliness or sore around the nipple or the areolas, discharge from the nipple. If you see the nipple looks different, again, you know your breast, you know your body, and it suddenly is drawn in or in a different direction. If the skin of the breast is puckered, again, that looks different. You see something is like pulling on it from inside. And if you have unusual pain in the breast. Now, these may be caused by non-cancerous lesions. It's really important for you to know that. And this is why, instead of just panicking, you need to consult your healthcare provider. So while it is good to do breast exams so you can see these, there is some doubt as to the effectiveness, certainly, of clinical breast exams in changing in the early detection and the change in the mortality from cancer. So the most effective tool we have today in either preventing or finding extremely early when it is curable breast cancer are mammograms and all the other tools such as ultrasounds and MRIs if indicated. So I will repeat this because it's really important. I know you just went over this, I will repeat it. So women ages 40 to 44 should have the choice, and these are American Cancer Society guidelines. I like using the American Cancer Society because usually you can see the sources of their recommendations. They have excellent references. And not all sources on the internet will do that. Women ages 40 to 44 should have a choice to start annual screening. Remembering, sometimes it's not a choice because if you don't have healthcare insurance or if you don't have access to a free clinic, you don't have a choice. So that is a part of the discussion earlier about access to care, choice, and so on. Women ages 45 to 54 should have mammograms every year. If you're 55 and older, as I said earlier, mammograms every 2 years, or can continue yearly screening. This may depend on whether your insurance will cover it every 2 years at that age group, or if you can afford it. It depends, and it will differ from health system to health system and coverage to coverage. Some women, because of a family history of breast cancer, again, so you don't only need to know your history, you need to know about your family history, and this will be when we talk later about cardiac and other health conditions, this comes into play as well. But you may have a genetic tendency or other factors that they may have may need to be screened with MRIs or ultrasounds along with mammograms. So if you have extremely dense breasts or you're having other conditions, mammogram might not be the most effective tool. Okay. Let's talk a little bit about gynecological cancers. So I'm going to speed up a little bit because I think I'm a little bit behind the time. Ovarian cancers, the risk of ovarian cancer increases with age. It's rare in women under 40. Again, being overweight or obese are at higher risk. Having children later or never having had a full-term pregnancy, having a late pregnancy increases your risk of ovarian cancer. And using estrogens alone or with progesterone after menopause also may increase your risk. Again, a family history of ovarian cancer, breast cancer, colorectal cancer. Ovarian cancer is increased if your mother, sister, daughter, or it can also come from your father's side, have had cancer, have had your ovarian cancer, and the risk increases the more relatives that you have with ovarian cancer. So, as was said earlier, you need to know for other diseases as well, hypertension, your risk for stroke, and all the rest of it, you need to know your family history. If you've had fertility treatment, in vitro fertilization, the hormones that you've had with that may increase the risk, or if you have a history of breast cancer. Factors that may lower the risk, pregnant before age 26, and multiple pregnancies. With each pregnancy, the risk seems to go down. Breastfeeding may also lower the risk. And again, these are due to a lot of interplays, some factors we don't know, and some of the interplays of our hormones as we go through these. Interestingly enough, oral contraceptives or tubal ligation may actually lower the risk of ovarian cancer, and a hysterectomy may increase the risk. So all of these are still being, the exact mechanisms are not absolutely clear as yet. So ovarian cancer signs and symptoms. Only about 20% of ovarian cancers are found at an early age. They're often asymptomatic. And I'm just there's a whole list of symptoms there, but they can be anything from an upset stomach, pain in the stomach or abdomen, fatigue, pain during sex, constipation, change in your period, swelling of your abdomen. So they can be, it is very difficult to diagnose early because a lot of the symptoms it may present with can be caused by other things. And you often do not think of it. So again, regular checkups and awareness of changes in your body. Cervical cancer. Another cancer that is quite prevalent in women. It's usually due to infection with the human papillomavirus. This is the most important risk factor. And it can spread during skin-to-skin contact and, of course, during sexual activity. In terms of getting a sexual history, people who are sexually active at a young age, having multiple sexual partners, or having one partner who has multiple sexual partners, this increases your risk, and this is likely due to be that you have more chances of being exposed to HPV. Women who smoke are about twice as likely to have cervical cancer than non-smokers, and having a weakened immune system. So for example, if you have HIV, or if you are on immunosuppressive drugs, this may increase your predisposition to getting cervical cancer. Again, a lot of other things, infection with chlamydia, long-term use of oral contraceptives, multiple full-term pregnancies, young age at first pregnancy, all of these have to do, it is felt, with some of these, I shouldn't say all of them, with your exposure to HPV. Economic status. The economic status, again, as we touched on briefly earlier, some women just don't have access to adequate health care. And so the screening tests and the things that we find it early are not available. A mother who has had stilbestrol during pregnancy, the child may have that. So they know these are adult women, but their mothers took DES when they were pregnant. And then a family history of cervical cancer. Symptoms, women with early cervical cancer and precancers, which is what we want to find, have no symptoms most of the time. So this is where screening is critical. It can be abnormal bleeding from the vagina after sex, after menopause. Any bleeding after menopause is a serious sign, something could be seriously wrong. So again, you must see your physician. Any unusual discharge, pain during sex, pain in your lower abdomen or pelvis. And then if it's more advanced, you can have problems with your urinating or with bowel movements or blood in the urine and so on. Again, the challenges is that because you're bleeding, unusual vaginal bleeding, doesn't mean you have cancer. There are a lot of other things can cause. Cervical cancer screening, American Cancer Society, usually between ages of 20 and 65, HPV test every 5 years, or you can have an HPV test and a PAP test, a combination. People over 65, if you've had regular testing with negative results for 10 years, you don't need to have no history of any abnormal cervical lesions, you don't have to have continuous screening. If you've had a problem before, you may have to continue screening. And if you have had your cervix removed for issues not related to cancer, you don't need to have screening. All right, so I'm looking at the time. I will just talk briefly endometrial cancer, more common in overweight women, about 3 more times than in women of normal weight. It is about 3 times more common in obese women than in women with normal weight. The older you get, the greater your risk. Diet and exercise. A fatty diet increases your risk. Exercise decreases your risk, as it does with breast cancer. Type 2 diabetes increases your risk. And it's important that this is linked in with the whole diet and exercise scenario. Having a family history with cancer, having had breast or ovarian cancer or other problems with your uterus, and having had radiation therapy. Again, the signs and symptoms may be unusual bleeding, a non-bloody discharge. So people tend to panic when they see blood, but it could be a non-bloody discharge. And then later you may have pain in the lower abdomen and pelvis, or unexplained weight loss, and so on. So this is can be difficult to diagnose. Any unexpected vaginal bleeding or spotting, you should report this to your healthcare provider. And in some cases, women who have a history that puts them at high risk may need to have a yearly biopsy. So this is repetitive, and I think you're going to hear this over and over for the next couple of presentations. So how do you decrease your risk? What makes it less likely that if you find a lump, if you see bleeding or spotting, if you're losing weight, that it is cancer? So avoid tobacco, get and stay at a healthy weight, be physically active, eat healthily, limit alcohol, and know your body, as I said earlier, your family history, and your personal risk factors. Talk to your doctor about any changes, your doctor, your nurse practitioner, your healthcare provider. Talk to them about any changes. Don't dismiss them or don't panic, but speak to someone about them. And get regular checkups and screening. This is how we will close the gap between the mortality and morbidity we see in cancer between Black and non-Black communities, because we tend to get healthcare later. So get your regular checkups and cancer screening. Sources are American Cancer Society. Thank you.
Thank you so much, Dr. Callender. Very informative lecture, and we heard about the positive effects of exercise. So we know how beneficial that is to everything that we can think of so many health problems where getting up and moving really matters. And, unfortunately, we also saw about limiting your alcohol. So those of you who had your first glass of wine, you may want to refrain from glass of wine.
Not have another one.
And if you have an opportunity to probably stop your screen, get up the chair and just walk in place for 5 minutes or so, just to get your blood flowing to your legs again. So